Good morning, this is Dr. Mary Brown Bates, and this is not personal medical advice, nor is this the opinion of my employers. It's a beautiful day out here, kind of misty, but still beautiful. I am going to talk, because it is this season, about people with sore ears, which is, for example, call up and say, could Dr. Braun please just take a quick look inside my ears, and I promise I won't ask her about her dog or her family, and I won't even let her ask me about anything. I just want a 90-second appointment to have Dr. Braun take a look inside my ears and tell me, do I need antibiotics or not? Well, you are absolutely right that it takes probably less than 90 seconds for me to look in both of your ears and tell you if you need antibiotics or not. And, maybe another 40 seconds to look in your mouth and see, do you have some postnasal drip? Do I think you have sinus? Whatever. I mean, you're right. We are talking about a very, very, very quick visit here. And that's what we get, that's what you think of when you think of a visit to the doctor, is you think about, the business end, Dr. Braun, of the visit, the business end of the visit, the working end of the visit. Dr. Braun looks in your ears. Dr. Braun says if you need an antibiotic or not. You get your diagnosis, you go on your way. But it turns out that really, there are a lot of people who collect a lot of information about you and the doctor visit in your visit, and a lot of the actual payment that doctor's office visits get or don't get is based on stuff like, did we ask you if you were depressed? If you're overweight, did we tell you to lose weight? Have we gotten your mammogram? Is your PAP up to date? Do you have a fire? Have we asked you if you have firearms in the house? Have we asked you if they're stored? Have we done the depression screener, etc., etc.? And there are people who keep track of these statistics and give them to the insurance companies and the various insurers. And if we have, and I'm just making these numbers up, but if we have, greater than 85% of our patients have been screened for depression, then we get, extra money. Or if we have, or maybe it's if we have less than, 73% of our patients who are overweight, we have forgotten to tell that they need to lose weight, then we lose money. I'm not sure how it works exactly, but I know that a significant portion of the money that healthcare systems get for taking care of patients is delivered based on whether or not the healthcare system meets these particular quality measures. And these quality measures, they come on like one at a time. Each one only takes 20 seconds to ask this question. And guess what? We have a whole series of these 20-second questions that mean it takes 12 to 15 minutes to put a patient in a room for what could literally be a 90-second visit. So when you call and you say, I just need a really quick visit with Dr. Braun, I'm sure she can squeeze me in like a piece of paper between two books, just because, it'll be a super, super quick visit. This is the only issue I promise that I will bring up. Well, true. It'll be a 90-second visit for me, but for my poor medical assistant, it's going to take her 12 to 15 minutes to room you. And guess what? If I am fully booked, how many spare seconds does my medical assistant have? If you guessed 0, you'd probably have guessed too high. They are running around all the time. I don't know how many steps they get in a day, but they're running around all the time, processing the specimens left by the previous patient, getting the next patient ready while I'm seeing this patient, cleaning the bathroom, making sure the rooms are stocked, getting the PAP labeled correctly and ordered correctly, and, packaging up the urine so it can go to the lab. I mean, they are busy doing stuff. Making phone calls, finding the form that somebody dropped off a week ago for the 2:00 patient to fill out with me or whatever. I mean, they are busy, busy, busy bees. And for me, I'm like, yeah, sure, I'll see an extra patient, not a big deal. But for them, it can be a big deal because they are already at the maximum of what they can do. And like I said, a 90-second visit for me is, you know, a 12 to 15-minute visit for them. So there you go. You know, there are exceptions to this. If you've been seen within the last 30 days, we don't have to re-ask you all the questions because the answers are unlikely to have changed. But guess what? If the medical assistant, you know, looks at the last time you were in and miscalculates how many days 30 days ago was, they're going to get a call from the quality department saying, you know, you've been missing a lot of these questions. What's going on? You know, so it's more complicated than it looks. It's more complicated than just, you know, the healthcare system is more complicated than just Dr. Braun takes a look in your ears and prescribes or doesn't prescribe antibiotics. And, you know, I've been doing this 20 years now, and I can definitely say that it gets more complicated, and there are more moving pieces that have nothing to do with whether or not Dr. Braun is looking in your ears and whether or not you need antibiotics every day. And, you know, I don't necessarily think it's a good thing. I don't know. I mean, yeah, of course we should be screening people for depression and telling people to lose weight. But I don't know. So this is the kind of reason that people go to urgent care, is because guess who does not have requirements to get mammograms and pap smears from people? So urgent cares can be quicker. That 90-second appointment really can be like 5 to 7 minutes. And and they don't have to do stuff like, you know, get your pap smear. They don't have to worry if you have your pap smear or not. You know, you're here for an ear infection. If, you know, we've missed your cervical cancer, bummer. You know, so, but then if the easy visits, the quote, easy visits, quote, like the ear infections go to the urgent care, that leaves more and more of only the complicated, time-consuming for the doctor stuff to be done by the healthcare centers, which is maybe not the best design. You know, I don't know. And then your doctor doesn't know, oh, you've had 3 antibiotics for ear infections when you come to see them and you've got, you know, a resistant antibiotic resistant bacteria in your urine or whatever, you know. So what is my point? What my point is that when you call and you think you have a 90-second visit with Dr. Braun, and why is Dr. Braun so mean and not just squeezing me in? Because I've promised that I won't take any of her time besides to just have her look in my ears. I promise that. It's quick. I know it's quick. It's not that Dr. Braun doesn't care about you or doesn't want to see you or is so, you know, so uncaring that she's, you know, going to make you suffer with your sore ear and see someone else. It's really that the healthcare system is so cumbersome right now. And there are all these moving pieces that are completely invisible to patients. So it's not that I don't love you. It's not that I don't care. It's not that I'm not willing to spend an extra 90 seconds at the end of the day looking in your ear. It's that it's important to keep the lights on at work. So, all right. Thanks for listening. Oh, and if you are my patient, of course, while this is not personal medical advice, and this is not a request to go to urgent care, this is not at all a request not to call and ask for an appointment if you need an appointment. It's just an explanation for why sometimes I can't just squeeze you in. So, despite, of course, that's my first instinct. All right. Thanks for listening.